Hey everybody, this is Dr. Vince from FTR in Joliet. I'm a physical therapist. I was asked by Marcy in Joliet to explain the importance behind performing the home exercise program. Now, I'll explain it in one sense, and another sense is going to come across as kind of flippant, but that you'll see where I'm going with that. For me, when I give a home exercise program, the prescription is just that. It's a prescription. And I take it extremely seriously. It's like taking a medication. And I'm giving that to the patient, but I'm only giving that to the patient after I've discussed why we're doing it, what are the pros, what are the cons, what are some of the possible side effects. And that's something that people may not know about. So I'm going to take basics, back pain, right? We know that there's research out there by Audrey Long to show that there may be one specific exercise that people respond to. And if we give you the wrong exercise, we may actually increase your symptoms and make them worse. The problem with that is that if we increase your symptoms and make them worse over the period of time, you're just going to assume that therapy had failed you. And it may not be that therapy failed you, but the explanations behind why you're doing exercises and the actual exercises themselves had failed. Or it was that specific therapist that had failed you. Right? So not all therapists are trained alike, and I actually have a blog post about that. If you go to movementthinker.org, you can read how not all therapists have the same knowledge base. Now, in getting back to why doing your home exercise program is important, we're gonna go back to back pain, because 80% of the population has back pain at some point during their life. And if we can treat your symptoms with one exercise and turn your back pain off and make you pain-free with one exercise, there's no reason for me to give you 5 to 10. There's a few reasons why patients say that they don't do their exercise program. One is they don't have time, but two is they don't understand why they're doing the exercises to begin with. That's not a failure on the patient. That's a failure on the practitioner who's giving the exercises. If I can help your symptoms with one exercise, it may not be worth it to give you 5 to 10. If one will get you to your goals, 5 to 10 may actually take you further from your goals. Not all exercise is good exercise. But after I've explained the importance of the exercise, and you understand the reason for the exercise, we should have this teamwork to go along to show that you're doing your exercises at home. Otherwise, what's the point of you coming into therapy? If you're not going to do your part, it makes it harder for me to do my part. Physical therapy is not something that's passive. It's not me doing things to you or the therapist doing things to you to try to fix your symptoms. There has to be something called therapeutic alliance, and that's a big word for teamwork, right? There has to be me and you on the same team in order to come to a common goal, which is typically pain relief or improved function. If at some point in time I am giving you an exercise that doesn't lead to pain relief or improved function, then again, that's my fault. So there has to be this therapeutic alliance, teamwork. Getting back to why it's important to do your exercise. If you go home and you do your exercises and they had absolutely no effect on your symptoms, I probably shouldn't give you that same exercise again. Because otherwise we keep running into this long period of time of no effect. If I can't show a pure cause and effect relationship to your symptoms, it's harder for me to continue to give you the same exercise over and over again. And why would the patient expect to have a different result if they're doing the same exercise over and over again and we didn't get a result to begin with? So that gets to the importance of doing the exercise. Now, if you do the exercise, only one of 3 options can happen, right? And this is getting a little bit deeper into the question, but that's okay. You have to understand the thought process that's going behind with a therapist in order to understand why you're getting the exercises you're getting. If I give you an exercise, only one of 3 things can happen. You're either better, you're either worse, or the exercise had no effect on your symptoms. If the exercise had no effect on your symptoms, I probably shouldn't do the same thing again, assuming you did the exercise the way it was prescribed. Now, if the exercise made you worse, I definitely shouldn't do the same thing again. If the exercise made you better, then we want to continue with doing the same thing again. It's not rocket science at times, but you have to have this teamwork so the patient understands their role and the therapist understands their role. The therapist has to be playing an active role in this. If there is not constant communication going on between the therapist and the patient, then the patient has no incentive to continue to do all these exercises at home. And if the therapist is giving exercises with no rationale given to the patient, again, the patient has no incentive to do all of these exercises at home if they don't understand why they're doing them. And so that's the basics of why it's important to do your exercises at home. And this is, again, assuming that the therapist is giving you the exercises that are going to best help your situation. And for every patient, that's a little bit different. It's very easy to give the term, you need a stronger core. But that's not always the answer, and honestly, that's rarely the answer when you look at the research. Doing segmental stabilization, such as you're on your back and raising one arm and raising one leg, has shown to be no more effective than doing other motions, such as standing up and sitting down from a chair. Okay, and this is where we have to figure out: is our goal pain relief? Is our goal improved function? If our goal is pain relief, then we should be trying to find an exercise that's relieving your pain, and it should show a cause and effect relationship right here and right now. Because if I can show that cause and effect relationship right here and right now, the patient is more likely to do the exercises at home because they can see that the exercises are going to help them. But if I can't show that cause and effect, it's hard for me to actually prescribe that exercise for pain relief. If it's for improved function, well, then we have to look at the function, right? If the function is you have trouble getting up off the toilet, then I should be giving you an exercise that simulates getting up off the toilet. Having you sit down on a ball or lay down on your back may not have that direct carryover to actually standing up. Okay, this is something called the specific adaptation on imposed demands. If there is something that you specifically want to do, then I have to impose that demand on your body frequently enough in order to create a change. And I have to impose it with enough intensity to create a change. Give you an example. If your goal is to be able to pick up a basket of clothes, right? I'm just coming up with examples off the top of my head right now. If your goal is to be able to pick up a basket of clothes, but I only train you with picking up a can of pop, you may never get to picking up that basket of clothes because we haven't trained that intensely enough. On the flip side, if I never have you pick something up off the floor, I haven't trained the specific movement pattern that you need in order to get better at picking up a basket of clothes. And so every patient needs a different scenario of exercises in order to get them to their end goal of either reduced pain, which is what we see in roughly 90% of the patients, or improved function. To take this one step further, there is a subset of patients who have dizziness or unsteadiness or balance issues, and their exercises are extremely important that they perform them at home because we may not see them in the clinic frequently enough in order to create the change in the clinic. So, for instance, some patients have symptoms of vestibular hypofunction, which means that their nerves that control balance, they don't work as well. And so in order to improve that efficiency of nervous output to improve your balance, you need to perform your exercises frequently. But again, that is our job as therapists in order to educate the patient regarding the importance of the home exercise program. And if that was never established during the session, then that's a failure on your healthcare practitioner and not necessarily a failure on the patient. I have to accept just as much of the blame for a patient not doing their exercise as the patient does initially. But after I've covered all of my bases and the patient's still not doing the exercise, then we have to reconsider the relationship, because this has to be a relationship of teamwork. And if I am doing everything I can to try to get you better, but you're not putting in the effort to get there, there's a wise mentor once said to me that if I care more about the patient than the patient cares about the patient, we have a problem. So that's the importance of the home exercise, Marcy, and I hope I answered your question thoroughly, and if not, feel free to leave comments. I'm more than happy to go back and cover home exercise programs because for me it is a prescription, and I take it that importantly as a prescription. Just like a physician would give medication, I prescribe movement. Thanks for the question. Have a good day.